This is a day I've been waiting for almost 4 years. After 4 years of dedicated work, Axelmed introduced the new dental implant paradigma. The Axelmed Paradigma project started in 2013, and when we started to develop Axelmed Paradigma, the mission was to create a quality medical device able to encompass the current state of art in implantology and to provide a clinician with a few tools, simple to use and proven effective, to complete the whole procedure from the surgical to the prosthetic phase as fluently as possible. Regarding the clinical features, the main objective was to develop an implant able to guarantee good primary stability in most of the cases, able to improve the aesthetic outcome with a well-performing surface and simple to use. Now let's talk about stability. Implant stability is the result of primary stability, it is a mechanical stability, and secondary stability, that is a biological kind of stability as the consequence of the disintegration process. Primary stability is important because it influences the secondary one, and it is the result of a series of different aspects, like the bone quality, the implant design, and the surgical procedure. This morning, I will focus on the implant design. This is the first prototype of Axelmed Paradigma, and this is the last prototype of the same implant. In the middle, there is over 1 year of tests and proofs. Why so much time? I'm going to explain you. Normally, implants with a wide diameter are an enlarged replica of one with a smaller diameter in terms of thread design. And initially, we also moved in this direction, but after our studies, we realized that the insertion of a 3.4 mm implant is completely different from a 5.0 mm one, especially when we talk about tapered implants. As a result of these tests, Axelmed Paradigma is presented in 5 different diameters, each one with a specific design, and if you give a look to this thread design, you can immediately appreciate how different it is from this one or from this one, and so on. In addition, in order to improve more the primary stability, Axelmed Paradigma design consists of a conical shape of the fixture, a thread with trapezoidal design with decreasing depth in the coronal apical direction and with a rounded corner higher than 19 degrees to allow bone formation in that area. Aesthetic. As most of you know, the modern era of implant dentistry started some years ago, and the first implant was introduced by Brandmark, and it was a parallel wall implant with a machine surface and an external connection. At that time, we accepted the resorption of bone of 1-2 mm, and we accepted the recession of soft tissue around the implant. The main issue this time was the integration of the implant into the bone. Someone called it osseointegration, someone else called it functional ankylosis. Some years later, the Swiss group introduced the tissue-level implant. Tissue-level implant has good functional results, but some limitation in prosthetic and aesthetic. In the 90s, we were introduced to the conical implant with different type of connection and to one-piece implant that demonstrate a very good capacity to stabilize bone and soft tissue around the implant, but it has clearly some prosthetic limitations. So during the last years, tissue stability around dental implant became a focus point, and also Axelmed worked a lot in this direction. Specifically, we tried to optimize the stability of hard and soft tissues, working on different aspects such as the back taper neck, the presence of microthreading, the platform switching, and the conical marginal seal. Back taper neck means more space and less compression. And looking at this slide, it is possible to understand the enormous advantage that this type of geometry as on the implant rehabilitations. This shows what we mean when we say regain bone. A 6 mm alveolar ridge is a very common size for the crestal bone. And if we use a 5 mm full round circular implant, we'll have 0.5 mm on each side of the alveolar bone, which is a very little bone. If we use the same size, a 5 mm Axelmed Paradigma implant, we obtain more bone on the buccal and on the lingual side. We have 1.1 mm of bone around the implant at the cortical side, and this is twice as much, and this is very good. If we want to have 1.1 mm of bone around a regular circular implant, we need to use a 3.8 mm implant, and this means less amount of bone tissue formed at interface. The second big advantage of a back taper neck is the reduction of cortical compression. For some clinicians, this is more important than gaining more bone. We know that mostly the cortical bone on the top of the crest is very purely vascularized because of the compression. Sometimes this is very detrimental, and many times we pay a price for that. We lose bone on the cortical bone because it doesn't like to be compressed. This design of implant reduces the compression of the bone. And in this paper, Barone evaluated this aspect. He placed 116 implants in 116 patients, dividing them in two groups. In the first one, he placed the implants with a high torque value, between 50 and 100 Newton centimeters. And in the second one, he placed the implants with a regular torque value, less than 50 Newton centimeters. Evaluating the bone resorption data in both groups, it's immediately clear how the resorption is higher in the group with higher torque, especially in mandibular site where the cortical bone is more present. In this clinical case, the concept of bone compression is well demonstrated. This patient has a classical distal dentalism with a good amount of bone vertically and horizontally. I performed my surgery, so I elevated the flap. Using this useful instrument by Axelmed, I perforated the implant site at the correct distance from the tooth, and finally, I placed the suture. And here I did the same. I elevated the flap. Using the same instruments, I perforated the implant site, I placed the implant, and finally the suture. But I want to focus on this detail. The gap around the implants. This gap means two things: more bone and zero compression. What will happen with this gap? It will fill by blood. That is the best metrics for new bone formation. Normally I never fill this gap with any kind of graft, but if someone prefers, could collect bone chips thanks to the bone regeneration drill designed by Axelmed, and could fill the gap with this autologous bone that is the best bone we can use for our patients. Here you can appreciate the pictures of the temporary prosthetic face on the right side, on the left side of the upper jaw, with the lateral view, and these are the X-rays controlled 3 months later after the surgery. The second feature, in order to stabilize marginal bone levels, is platform switching. I will discuss the microthread in a second moment. Platform switching concept was introduced in 2006 by Lazzari and Porter. They published a report stating that by creating a mismatch between the platform of the implant and the platform of the abutment, there is a higher rate to preserve peri-implant bone. This benefit is nowadays generally accepted, and a lot of papers confirm it. Anyway, it is a good benefit, but it is not enough. Another important aspect is the shape of the abutment. And watching this slide, you can easily appreciate how the presence of both a concave emergence profile of the abutment joined with a platform switching concept is the best condition to improve the amount of peri-implant soft tissue. Through this simulation, this is better explained. Here we have two implants with the same diameter and both implants with the same platform switching. Anyway, on the right, there is an implant with a neck with a back taper design and an abutment with a concave emergence profile. On the other end, we have a parallel wall implant with a straight abutment. And this is the result. This design allows a greater amount of hard and soft tissue around the implant, and it means a better aesthetic and a greater possibility to create a gingival seal around the connection and to protect the implant from bacteria penetration. One simulation more, and again with two adjacent implants. The position of the connection is a must in order to reduce undesirable unscrewing of the connection screws and in order to reduce bacteria penetration. Axelmed Paradigma has an hexagonal internal connection. It is very simple to use and it is compatible with a lot of implants on the market. Anyway, we know that the conical connection is the best connection in terms of reduction of bacteria penetration and stability of the abutment. It is more precise, but it is uncomfortable to run for the clinicians. That's why we find this solution, an hexagonal internal connection with a circular conical marginal seal in this area. In this area there is a conical part and there is the same part inside of the implant. The two conical parts differ one from the other for 1 degree. So when the abutment is seated on the implant, there is a plastic deformation of the material and a sort of cold welding between the parts. This happens also because the abutment is made of titanium grade 5 and it is harder than the implant made of titanium grade 4. Now let's talk very quickly about the surface. Today on the market we can choose between implants with completely rough surfaces, implants with completely rough surfaces and microthreading, implant with rough surfaces and a transmucosal machine neck, implants with completely machined surface, and the implants with hybrid surfaces. But we know that from the literature we have 3 important informations. This is the first one. This is a systematic review that evaluates bone resorption around the implant neck using implants with different surfaces. So the authors compared implants with machine surface versus implants with rough surface, implants with rough surface versus implants with rough surfaces and microthreading, and finally implants with machine surfaces versus implants with rough surfaces and microthreading. And it is surprising that there is a statistically significant difference in terms of bone loss between implants with rough surfaces with microthreading and implants with rough surfaces without microthreading. Therefore, this means that microgrooves play an important role in preserving peri-implant bone. And these results are very interesting. However, this review doesn't take into account the role of peri-implantitis. And this is the second point. Here you can see another review where the authors compared the risk of developing peri-implantitis between implants with machine and rough surfaces. In the results, they write that the machine surfaces reduce by 20% the risk of developing peri-implant infections. The third point is this one. During the second consensus conference of the European Association of Osseointegration, with respect to the confusion in terminology, the research group accepted the definition for surface roughness for oral implant specified by Albrechtsen and Wennerberg, according to which the topography of the surface is divided into smooth surfaces, minimally rough surfaces, moderately rough surfaces, and rough surfaces. We know that rough surfaces accelerate the osseointegration process. Anyway, according to the literature, there aren't any statistically significant differences between implants with different roughness in terms of osseointegration. However, it seems that osteoblast attachment is better on moderately rough surfaces. That's why we decided to choose a moderately rough surface for Axelmed Paradigma. So, summing up the informations, the literature and the evidence-based medicine tell us that microthreads reduce stress and promote new bone formation, that machine surface reduces the risk of developing periimplantitis, and that rough surface accelerates the osseointegration process. In light of all these reasons, it was natural for us to develop an implant with a micro-rough surface at the level of the body and with a machine surface at the level of the neck with the presence of microthreads. Anyway, a lot of time we discuss about the surface geometry without considering the degree of decontamination of that surface. And it is really unbelievable that the CE certification on a medical device, such as devices like dental implants, claims that in order to obtain the certification, the implant needs to be as clean as possible. What does it mean? It doesn't mean nothing. When we started the development of the surface, we knew what we wanted, an implant with an hybrid surface, and we knew that the degree of roughness is not very important for osseointegration. So we asked to our first production partner to treat the surface for us. This company manufactured dental implants for over 30 years, so we were full of confidence on the results, and we treated hundreds of implants in that way. Anyway, when we asked to a laboratory to perform a surface analysis, this was its report. It was horrible. This is the first surface production of Axelmed Paradigma. It was already certified implant with CE certificate, and its surface is an horrible surface because it has a very poor percentage of titanium exposure, a lot of aluminum oxide, and a lot of organic and inorganic residues. So in that moment, we realized that we must develop a serious protocol for the surface treatment, and we started a 1 year long test in order to reach it. So we started from here in January with this surface full of aluminum oxide and organic and inorganic residues. And in March, this was the aspect of the surface, and more in April, in June, and finally in October, we received this kind of report. It is a very clean surface with the completely absence of residues of aluminum oxide residues and with traces of only organic contaminants. Specifically, this is the surface and there is a 17% of pure titanium exposure on the surface. After the milling process from ear to ear, there are a series of checks and treatments for a total of 30 different steps. Regarding the surface treatment, the implant is sandblasted with pure aluminum oxide. It follows a triple acidification treatment, and finally, before the packaging and the sterilization phase, it undergoes to a double treatment in a plasma argon reactor. This machine allows a sort of ionic etching and allows to remove any kind of organic residues from the surface. Following the DOAM protocol, we performed the so-called implant standard identification surface. Doan is a doctor who did a very smart and useful work. He collects the main important implants present on the market from international companies and he analyzed the surface, creating a sort of surface passport. Axelmed, following the same protocol, using the same technological machine and collaborating with an independent laboratory, created the same passport and compared these results with those of other companies with regard to the presence of contaminants and the presence of titanium exposure on the surface. We are very proud of these results because we are a young company, but our results are better than the results of a series of big and famous companies. And now, final step, simplicity. For Axelmed, simplicity passes through three steps. First one, only one implant line. Why I need to choose between a lot of implants when I can achieve the same results using just one implant? Second point, just one prosthetic connection for 5 diameters. This means less components and simplification. And finally, the third way for simplification is named all-in-one. It is very simple. It is a small box containing everything you need to solve 70-80% of clinical situations that we daily bumped into in our dental offices with a great saving of time, money, and stress. Axelmed entered into the market in January of 2017. After few months, it is in more than 20 countries, and a lot of clinicians use every day the Axelmed Paradigma implant with very good outcome. Thank you very much for your kind attention, and if you need more information, you can text me on clinical@axelmed.com. Thank you very much.